Hi, I'm Dr. Daniel Meyerkort from Perth Orthopaedic and Sports Medicine, and today we're going to talk about risks after knee replacement surgery. So in surgery, all surgery is a balance of risk versus benefit. We like to recommend surgery or are comfortable with you undertaking that decision if we anticipate that your benefit is going to be high and that your risks are going to be low. I get patients come in and they say, I want you to guarantee that nothing will go wrong. Despite my best care and best effort, this is not possible. All that I can do is say, I believe your benefit is very likely to be high and your risks are likely to be low. When we're looking at knee replacement, someone who's got severe arthritis, severe pain and is disabled is going to have high benefit, whereas someone who has mild to moderate pain and can still walk up to an hour is going to have less benefit. When we're talking about risk, someone who is fit, healthy, ideal body weight, doesn't have cardiac disease, has not had a heart attack, has not had any issues with blood clotting, bleeding or lung issues, and is otherwise in good health is going to be low risk. Someone who's got diabetes, smokes, has a very high BMI is going to be high risk. So these are some of the most important concepts that we look at when we're looking about risks associated with surgery. With specific risks, I'll start off with the ones that we see more commonly but are relatively minor, and then I'll finish with the ones that are far less common but certainly more severe. So risks like wound redness, small blood clots in the legs or lungs, which are called DVT or PE, low-grade chest infection, low-grade confusion, swelling around the knee, pain, and stiffness are all relatively common. These are all things that in general are treated in hospital. Major complications or unusual risks are a large DVT or large pulmonary embolism blood clots, major heart attack, major stroke, death, which is very rare, fracture around the prosthesis, component malposition, need for early revision surgery due to infection or damage to surrounding structures like nerves, blood vessels, ligaments, tendons or muscles. So in summary, we've talked about risk, we've talked about benefit, but the most important thing is what are your risks, and that is very tailored towards you. In general, if your benefit is perceived to be high and your risks are low, then in general that is someone who's going to benefit greatly from knee replacement. And conversely, if your benefit is perceived to be less high or if your risks are high, then we are obviously a lot more cautious about proceeding with that type of surgery.